Hello, my name is Zarif Kazi, and I'm going to be doing my case review two of the COVID-19 virus. My role is Minister of Finance slash Secretary of Treasury. So just to begin with, we'll have an overview of the case. So in 2019, China reported a cluster of cases of pneumonia associated with the wholesale market in China. And as of 2020, the health authorities confirmed that this cluster was associated with the novel coronavirus called SARS-19. And so originally associated with exposure to the food market, but person-to-person transmission was also reported. As of 2020, 9,976 cases had been reported in at least 21 countries. So it went from an epidemic to a pandemic. And just to skip to the last line, as of June 5th, over 6.75 million cases have been confirmed with over 393 deaths across 210 countries. So basically a global pandemic. So just to begin with, we're going to be talking about what is COVID-19. So COVID-19 is a highly infectious respiratory illness. It is caused by the novel coronavirus SARS-CoV-2. This is a single-stranded RNA virus belonging to the family Coronaviridae. And what makes this virus unique is the presence of spike proteins, which allows it to interact with human cells. So essentially, these spike proteins, they attach to ACE2, which is a particular receptor on human cells, and this enables the virus to enter and proliferate inside the cells. This virus has a relatively long incubation period. The symptoms typically present within 2 to 14 days after exposure. So that tells us that it has a relatively long incubation period since it can cause symptoms up to after 2 weeks of being exposed to the source. The primary mode of transmission is through respiratory droplets. So if an infected person talks, coughs, or sneezes, they will transmit it to a non-infected person. And it can also spread by touching surfaces contaminated with the virus and then touching your face. For example, if an infected person sneezed on their hand, touched the door handle, and then you touch the same door handle and touch your face, that would also spread the virus. The symptoms of COVID-19 vary. It ranges from mild to severe. Some people might be completely asymptomatic as well. Common symptoms for the symptomatic patients include fever, cough, fatigue, and loss of taste or smell. It can also present pretty severely, and in terms of severe presentation, it can cause pneumonia, acute respiratory distress syndrome, organ failure, and even death, unfortunately. So how do we reduce the transmission of COVID-19? So the four guidelines that we have to follow to reduce the spread of COVID-19. Number one is to wash hands. Regularly washing hands with either soap or alcohol-based sanitizer can help reduce the spread of COVID-19 because it removes the virus particles present on your hands. In the example we talked about earlier, if someone sneezed before touching the door handle, if they used its hand sanitizer or they washed their hands with soap, then they would have been perfectly fine and it wouldn't have spread. Number two is wearing a mask. We also talked about how coughing, sneezing, and talking can help spread the virus through the respiratory droplets. So wearing a mask can help spread the virus because it traps the droplets within the mask. Number three is quarantining. So infected people can spread to non-infected people through the means we mentioned before, which is contact through objects or respiratory droplets. Once a person is confirmed positive, if they are quarantining, this can help prevent spread to non-infected people, and specifically the susceptible people such as the elderly or people with pre-existing conditions. And number four is social distancing. Again, this relates to what we talked about in terms of the respiratory droplets when someone coughs, sneezes, and talks. If you are 6 feet apart, which was the distance that was recommended, it helps reduce the number of droplets that you interact with from the person that you are talking to, and so it can reduce transmission. So specifically, what is the role of the Minister of Finance or the Secretary of Treasury? So the role of the Minister of Finance in handling the COVID-19 pandemic can vary, and depending on the countries, different ministers of finance have different roles and responsibilities. However, in general, essentially the role of the Minister of Finance is providing financial resources and support to those in response to the efforts of the pandemic. And over here, I have four examples of four things that the Minister of Finance will be responsible for. Number one, for example, will be allocating funds. So this can be for supporting the healthcare systems, which are severely burdened due to the pandemic. There was a patient overload, and so they needed a lot of financial support, and for medical research as well. And next thing is providing economic relief. So this can be relief to individuals, businesses, and anyone who had been affected by the pandemic economically. Number three is development of a vaccine. So Minister of Finance is responsible for allocating funds to the development of a vaccine. This can help support the distribution of the vaccine as well, but not only limited to the vaccine, it can help in development and distribution of other medical supplies. For example, there was a pretty massive short of ventilators at the time, and so funds needed to be allocated for that as well. Number four is collaboration. Given that it's a global issue, there needs to be a lot of collaboration with the Minister of Finance, not only locally, but internationally as well, in developing policies that can help the global recovery from the pandemic. Next, we're going to talk about the role of the Secretary of Treasury. It's pretty similar, but there are some differences. So over here, we talk about how providing financial support, as we mentioned with the Minister of Finance as well. So Secretary of Treasury is also responsible similarly through the administration of stimulus payments and loans. And the Secretary of Treasury additionally has to work with the Federal Reserve to support the functioning of the financial markets and ensure the availability of credit for businesses and households. And then number three, coordinating with other government agencies. As you mentioned, the Minister of Finance has to do the same. A couple of examples of who the Secretary of Treasury might have to coordinate with would include the Department of Health and Human Services, because it is largely a public health issue. Small Business Administration, because small businesses were massively affected by the pandemic. And yeah, so working with these government agencies to implement policies to mitigate the economic impact of the pandemic. And the fourth point is providing guidance on tax policy and regulatory issues. So because of the pandemic, a lot of people are affected economically. So taxes need to be slightly modified in order to accommodate for that. The tax burden of people who are already undergoing economic crisis might be too much. How to resolve the economic burden caused by COVID? So it is a very, very complex issue, so we can't go too in depth about it. But a couple of examples, which we talked about earlier, but I want to maybe give a few more examples. And this slide is providing economic relief to individuals and businesses, as we mentioned before. This is very, very important. This can be done through stimulus payments, unemployment benefits, and small business loans. As I mentioned previously, small businesses were massively impacted by this, so they definitely needed loans to help them recover from this pandemic and even get through it. Support job creation and workforce development. So a lot of jobs were cut down due to the pandemic because of the economic crisis. Companies had needed to cut costs. A lot of people were let go. So governments can invest in job creation, and this can help individuals who have lost their jobs due to the pandemic find new employment opportunities. Next thing is invest in infrastructure projects. These projects create new jobs and provide long-term economic benefits. It also helps the society progress as a whole, even after the pandemic. For example, if public transport has been invested to during this time, it helps create jobs, but also the public transport system of that city is improved as a long-term goal. And the last thing is promote international cooperation. Countries can work together to develop and implement policies to support global economic recovery. As I mentioned before, because it is a global issue, countries all around the world need to cooperate together to kind of get through this together. Thank you.